When we talk about pancreatic cancer, it helps to start by gently understanding what this disease actually is, because the word cancer alone can feel overwhelming and frightening. Pancreatic cancer begins in the pancreas, an organ that most people rarely think about, even though it quietly works every single day to support life. The pancreas sits deep inside the body, behind the stomach, and it plays a vital role in helping the body digest food and control blood sugar. When pancreatic cancer develops, it means that some of the cells in this organ begin to grow in an uncontrolled and abnormal way. Instead of following the body's normal rules, these cells change, multiply, and form a mass that does not belong there. Over time, this growth can interfere with how the pancreas works and how nearby organs function, which is why this disease can have such serious consequences. What makes pancreatic cancer especially challenging is that it often grows silently, deep within the body, without drawing attention to itself in the early stages. Because the pancreas is tucked away and not easily felt or seen, changes can occur without obvious signals, allowing the disease to progress quietly. Many people are shocked when they first hear this diagnosis because they may have felt mostly normal before learning something serious was happening inside them. Pancreatic cancer is not one single condition, but a group of related diseases, depending on which cells in the pancreas are affected, although most cases start in the cells that line the ducts carrying digestive juices. As the abnormal cells continue to grow, they can begin to press on nearby structures or spread beyond the pancreas, which is why this disease is often described as aggressive. Hearing the words pancreatic cancer often brings a rush of fear, confusion, and unanswered questions, and that reaction is completely human. It forces people to confront uncertainty and to process information they never expected to need. From a medical perspective, pancreatic cancer is known for being difficult to detect early and difficult to manage once it has advanced. But from a human perspective, it is a disease that deeply affects emotions, families, and the sense of control people feel over their own bodies. It reminds us that not all illnesses make themselves known right away, and that the body can sometimes carry serious problems quietly. Understanding what pancreatic cancer is does not mean accepting fear or losing hope, but it does mean recognizing the seriousness of the condition and the importance of awareness, attention, and timely medical care. If you or someone you love is learning about this disease right now, know that asking questions and seeking clear information is a powerful first step. You are not wrong to feel worried, and you are not alone in trying to understand something that feels heavy and complex. Staying informed, listening carefully, and continuing to learn can help you feel more grounded and supported as you move forward, and that is why continuing this conversation truly matters. When people ask about the causes of pancreatic cancer, I always want to answer this with care and honesty, because this is where guilt and self-blame often quietly appear. And I want to be very clear that this disease is rarely caused by one single reason or one single choice. Pancreatic cancer usually develops over many years as a result of a combination of factors that slowly affect the cells of the pancreas. At the most basic level, cancer begins when normal cells become damaged and start behaving abnormally, growing and dividing when they should not. This damage can come from long-term stress on the body, repeated inflammation, exposure to harmful substances, or changes passed down through families. Age plays an important role because as we get older, our cells have had more time to collect small errors, and the pancreas is no exception. Lifestyle factors can also increase risk over time, especially habits that place constant strain on the pancreas and surrounding organs. Smoking is one of the strongest known contributors because harmful chemicals from tobacco enter the bloodstream and repeatedly pass through the pancreas, slowly injuring its cells. Long-term heavy alcohol use can also damage the pancreas by causing ongoing inflammation, which makes the environment inside the organ more unstable and more likely to develop abnormal cell changes. Certain long-standing health conditions can raise risk as well, particularly diabetes and chronic inflammation of the pancreas, both of which alter how the pancreas works day after day. Excess body weight can add another layer of stress by affecting hormone balance and increasing inflammation throughout the body, including the pancreas. Family history is another important piece of the puzzle because some people inherit genes that make their pancreatic cells more vulnerable to damage, even if they live a healthy lifestyle. This does not mean pancreatic cancer is guaranteed, but it does mean the margin for error can be smaller. Exposure to certain chemicals in the workplace over many years may also play a role, especially in jobs involving heavy metals or industrial substances. What makes this difficult is that many people who develop pancreatic cancer do not fit a clear pattern at all. They may never have smoked, rarely drank alcohol, and tried to take care of their health, yet the disease still appears. This is why it is so important to understand that causes are about risk, not certainty. And having one or even several risk factors does not mean someone did something wrong or could have fully prevented this. The body is complex, and sometimes cell damage happens quietly without a clear explanation. As a doctor, I see how painful it can be when patients look back on their lives searching for a reason, replaying decisions, and wondering what they could have changed. While learning about causes can help us understand risk and encourage healthier choices moving forward, it should never become a source of blame or shame. If you are listening to this and recognizing some of these factors in your own life, the most important thing to remember is that awareness is not meant to frighten you, but to empower you. Paying attention to your health, staying connected with your doctor, and taking concerns seriously can make a real difference. And if this information has stirred worry or questions in your heart, please don't carry that alone. Keep listening, keep learning, and let this be a gentle reminder that your health matters, your concerns are valid, and seeking understanding is an act of care for yourself and those who love you. When we talk about the symptoms of pancreatic cancer, I want you to listen gently and without panic, because one of the most difficult things about this disease is that its early signs are often quiet, vague, and easy to dismiss, even by very attentive people. Many symptoms do not appear suddenly or dramatically, but instead creep in slowly, blending into everyday life in a way that makes them feel normal or explainable. A person might notice a deep, persistent tiredness that doesn't go away with rest, or a general feeling that their body just doesn't feel the same anymore, even though they can't clearly explain why. Appetite may begin to change in subtle ways, where food that once felt comforting no longer brings the same interest or satisfaction, and meals may feel heavy or uncomfortable without an obvious reason. Some people experience unexplained weight loss, not because they are trying to lose weight, but because their body is no longer using nutrients the way it should. Digestive changes can appear as well, such as ongoing discomfort after eating, changes in bowel habits, or stools that look different than usual, which can be confusing and embarrassing to talk about, leading many people to ignore these signs longer than they should. Pain can develop, often as a dull ache in the upper abdomen or back. And what makes this pain tricky is that it may come and go, or feel worse when lying down and better when leaning forward, making it easy to mistake for muscle strain or indigestion. Some people notice their skin or eyes slowly taking on a yellowish color, a change that may first be spotted by a family member rather than the person themselves, along with darker urine or lighter-colored stools, which can feel alarming when they finally become noticeable. Itching without a clear rash can also appear, adding to discomfort and frustration. Diabetes that suddenly appears or becomes harder to control can sometimes be a clue, especially in adults who never struggled with blood sugar before. Emotionally, many patients describe a sense that something is wrong long before they can name a specific symptom, a quiet intuition that their body is trying to send a message. The challenge is that none of these signs alone clearly point to pancreatic cancer, and they can easily be blamed on stress, aging, diet changes, or other common conditions. That is why this disease is often discovered later than anyone would wish. I want to be very clear and compassionate here. Having one or even several of these symptoms does not mean you have pancreatic cancer, and most people with these complaints do not. But what matters deeply is listening to your body and noticing patterns, especially when symptoms persist, worsen, or don't make sense for you. If something feels unusual or continues despite time and rest, it deserves attention, not fear, but care. If you are hearing this and recognizing yourself or someone you love, please see this not as a reason to panic, but as a reason to speak up, ask questions, and seek medical advice. Early conversations can lead to clarity, reassurance, or timely action, and all of those outcomes are valuable. Your body's signals are not something to ignore or feel embarrassed about. They are a form of communication, and responding to them with kindness and curiosity is one of the most powerful things you can do. If this message has touched a concern in your heart, stay with us. Keep listening. And remember that paying attention today can protect tomorrow for you and for the people who care about you most. When we talk about prevention in relation to pancreatic cancer, I want to approach this gently and realistically because prevention here does not mean control or guarantees, and it certainly does not mean blame. What it truly means is reducing risk where possible and caring for the body in ways that support long-term health. Since pancreatic cancer often develops silently over many years, prevention focuses on protecting the pancreas from ongoing stress and damage. One of the most meaningful steps is avoiding tobacco in all forms, because smoking exposes the pancreas to harmful chemicals again and again, slowly increasing the chance of cell damage. If someone has smoked for years, stopping still matters deeply because the body begins to heal the moment exposure ends, and risk can slowly decrease over time. Alcohol use is another area where balance and awareness are important because heavy drinking can cause repeated inflammation in the pancreas, creating an environment where abnormal changes are more likely to happen. Choosing moderation or avoiding alcohol altogether can help protect this delicate organ. Maintaining a healthy body weight also plays a role, not for appearance, but because excess weight increases inflammation throughout the body and affects how hormones work, placing extra strain on the pancreas. Gentle, consistent movement and mindful eating can support the pancreas without extreme rules or pressure. Managing blood sugar carefully is especially important for people with diabetes because stable blood sugar reduces stress on pancreatic cells. Regular medical checkups help catch changes early, even when you feel well, and this is particularly important if pancreatic cancer runs in your family or if you have long-standing health conditions affecting the pancreas. Prevention also includes paying attention to what the body is quietly communicating. When digestion feels off for long periods, when weight changes without explanation, or when fatigue becomes persistent, bringing these concerns to a doctor is not overreacting, it is responsible self-care. Reducing exposure to harmful chemicals, especially in work environments, can also support overall pancreatic health, and using protective measures when recommended truly matters. Just as important as physical prevention is emotional care, because chronic stress affects the entire body, including how inflammation and hormones behave. Finding ways to manage stress, whether through rest, connection, prayer, movement, or quiet moments, supports the body's natural balance. It's also important to understand that even people who do everything right can still develop pancreatic cancer, and that truth can be frightening. Prevention is not about achieving perfection, but about stacking the odds gently in your favor and staying connected to your health. Knowledge, awareness, and consistent care create a foundation where concerns are noticed earlier and addressed with clarity. If you are listening to this and thinking about your own habits or family history, let that awareness be empowering, not overwhelming. Small changes, made consistently, matter more than dramatic promises. Choosing to care for your body today is an act of kindness toward your future self. And if this conversation has made you pause, reflect, or feel motivated to take your health more seriously, please hold on to that feeling. Talk to your doctor, share this information with someone you love, and keep learning with us. Staying informed and attentive is one of the most powerful ways to protect yourself, and you deserve that care, that attention, and that hope. When we talk about treatment and solutions for pancreatic cancer, I want you to hear this through a calm and caring voice, because this part of the journey is often where fear is strongest, yet it is also where support, science, and human compassion come together most clearly. Treatment for pancreatic cancer is never one-size-fits-all, and it is always based on the individual person, the stage of the disease, overall health, and personal wishes. For some people, treatment aims to remove the cancer if it is found early enough, while for others, the focus is on slowing the disease, easing symptoms, and protecting quality of life. Surgery can be an option in certain cases, especially when the cancer is still limited to the pancreas. And while it is a major procedure that requires careful recovery, it can offer a meaningful chance to control the disease. For many patients, treatment also involves medicines that travel through the bloodstream to reach cancer cells wherever they may be, working to slow their growth or shrink them over time. These treatments are often given in cycles, allowing the body time to rest and recover in between, and doctors monitor patients closely to adjust plans based on how the body responds. Radiation therapy may also be used in some situations to target cancer cells more precisely, especially when surgery is not possible or when additional control is needed. Beyond these medical treatments, supportive care plays a deeply important role, even though it is sometimes overlooked. Managing pain, improving digestion, supporting nutrition, and addressing fatigue can dramatically improve daily comfort and strength. And these are not secondary goals. They are essential parts of treatment. Emotional and psychological support is just as important because a diagnosis like this affects the mind and heart as much as the body. Many patients find strength in counseling, support groups, spiritual care, or simply having honest conversations with their medical team. It is also important to know that treatment plans can change over time, and that does not mean failure. It means the care team is responding thoughtfully to what the body needs in that moment. Advances in research continue to bring new options, new combinations, and new hope, and clinical trials may be available for some patients, offering access to promising therapies under close medical supervision. Throughout all of this, the most important solution is not just a specific treatment, but a partnership between patient and doctor built on trust, communication, and respect. Asking questions, expressing concerns, and sharing how you truly feel helps guide better care. For family members and loved ones, being present, listening, and offering steady support can make an enormous difference, even when words feel inadequate. If you or someone you love is facing pancreatic cancer, please remember that you do not have to navigate this alone, and you do not have to be strong every moment. Accepting help is not weakness, it is wisdom. Treatment is not only about fighting disease, but about preserving dignity, comfort, and meaning through every stage. If this video has helped you understand even a small part of this journey, I invite you to stay connected, share this knowledge with others, and continue learning with us. Your time, your health, and your story matter deeply, and hope can exist even in the most difficult conversations. As we come to the end of this conversation, I want you to take a slow breath and remember that learning about a serious illness like pancreatic cancer can stir many emotions at once: fear, concern, reflection, and sometimes even a quiet sense of vulnerability. And all of those feelings are completely valid. Information is not meant to scare you, but to gently light a path where uncertainty once lived. If something you heard today made you pause, or made you think about your own health or the health of someone you love, please don't push that feeling away. Let it guide you toward awareness, toward conversations, and toward care. You don't need to diagnose yourself, and you don't need to assume the worst, but you do deserve to listen to your body and take your concerns seriously. A simple conversation with a doctor, an honest check-in, or even asking one question can bring clarity and relief. If you are here because you or someone close to you is facing this disease, know that you are not weak for feeling overwhelmed, and you are not alone in this journey. Strength does not mean having all the answers. It means showing up, one day at a time, and allowing support to exist around you. For family members and caregivers, your presence matters more than perfect words ever could. Listening, sitting quietly, and offering consistency can be a powerful form of love. I also want you to remember that medicine is not just about treatments and outcomes. It is about people, stories, and moments of connection. Even in difficult diagnoses, there can be comfort, dignity, and meaning when care is guided by compassion and honesty. If this video helped you understand something new, or helped you feel less alone with your thoughts, consider sharing it with someone who might need it too. Sometimes one shared video can open a conversation that has been waiting to happen. Stay curious about your health, stay connected to professionals you trust, and never feel embarrassed about asking questions. Your body speaks to you every day, and listening is an act of respect, not fear. We are here to keep these conversations open, clear, and human, because knowledge grows stronger when it is shared with care. Thank you for taking the time to be here, for listening with an open heart, and for choosing awareness over silence. If you want to continue learning, reflecting, and protecting your health, stay with us, and let's keep walking this path together, calmly, honestly, and with hope.